Good morning. I am Dr. DeCroce. It's nice to meet you. What seems to be the problem here?
Hello, doctor. I'm Kelly, and this is Jay. Jay's 4 months old, and, well, she doesn't seem to be developing quite right. I feel awful because I hadn't noticed it until now, but all of her symptoms seem to have occurred all of a sudden. I don't know what's going on, and I'm getting really, really worried.
Could you tell me more about her symptoms?
Her motor skills are where I notice it the most. She has trouble turning over when I lie her on her back, and she has a lot of trouble controlling her head and sitting up. She can't sit up for more than a second. It's like her head pulls her back down.
It seems that your daughter has an unusually weak muscle tone, and she also appears to have a larger head, which is also known as macrocephaly. Okay, so there are a couple causes for this kind of lagging in motor development. First, I'm going to need to take a look at your family history carefully. Depending on what I find, I will need to take some blood and urine tests from Jay, and then we'll just go from there.
Okay, I'm just really worried. My husband and I both tested positive as carriers for a gene that causes Canavan disease, and the symptoms that Jay has remind me of what the doctor said when we were tested. Can you test for that as well?
Traces of this disease will be present in the blood and urine tests, and if we find these traces, we will need to perform an MRI before we can confirm conclusively the specific cause of Jay's symptoms. Okay, so both the blood and urine samples showed traces of N-acetyl aspartate, NAA, which is commonly in abundance in those with Canavan disease, but we need to perform an MRI.
Okay, what are the chances for her?
The results from these tests seem to indicate the worst. However, the data provided by the MRI may or may not reinforce this prognosis.
Alright, can you tell me a little bit more about the history of the disease? I've read a little bit online, but I never know what to believe.
Absolutely. In 1931, Mertel Canavan was the first pathologist to describe Canavan disease, and in 1993, Dr. Ruben Madelon discovered the gene that causes Canavan disease via tissues donated by affected Canavan families.
Are there some ethnicities that are more affected than others? I know it seems strange that both my husband and I tested positive as carriers of the disease.
Canavan disease can occur within any ethnic group. However, it is found more frequently in those of the Eastern European Jewish ancestry, where it is estimated that 1 in 40 are carriers as compared to the general population, where it is about 1 in 300.
My husband and I are both of Eastern European Jewish descent, so that explains why we're both carriers. Doctor, be honest, what are the chances that Jay has this disease?
There's about a 25% chance. We will look at the results from the MRI and let you know as soon as possible. Okay, so on the MRI, we found the characteristics of Canavan disease. I'm very sorry, but now I am fairly confident in this diagnosis.
Oh my God, what is going to happen to her? Is there anything you can do?
I am sorry. Unfortunately, Canavan disease sustains progressive brain atrophy, and death usually occurs before the age of 10.
What are you saying? What's happening to Jay's brain?
This disease stems from a mutation in the ASPA gene, which encodes an enzyme called aspartosylase. This is responsible for the normal breakdown of a concentrated chemical called N-acetyl aspartate, which is what we first looked for in the blood and urine samples.
I still don't understand. What happens if NAA isn't broken down?
Well, since the enzyme to break down NAA is not encoded correctly, there is an accumulation of N-acetyl aspartate. This damages a type of cell called an oligodendrocyte. This is the cell in the brain that creates insulation around the nerve cell, known as a myelin sheath.
Okay, so Jay can't make those now. What does that mean is happening to her brain?
So this is a nerve cell in Jay's brain. Essentially, a myelin sheath would look like this. It would wrap around the axon. So N-acetyl aspartate prohibits these oligodendrocytes to mature, and this means that there is no myelin sheath. Without this insulation around the nerve cells, the cell loses the protection and nutrients that would normally be provided by the insulating myelin sheaths. This means that messages that the cell attempts to send are left in a vulnerable state and cannot properly function to support the communication process.
So eventually her brain isn't going to be able to function at all. Is that what you're saying? What's going to happen?
Without mature and living oligodendrocytes within the brain will begin to degenerate into a spongy tissue marked with several microscopic fluid-filled spaces. Basically, brain atrophy will be the end result of this disease.
But what can we do? There has to be something. What treatment options are there? We'll try anything.
As of now, there is no cure, and there aren't many promising treatments for this disease at the moment. For the most part, all we can do now is to try to ease the symptomatic aspects of the disease until Jay's brain degenerates to the point of atrophy.
Okay, so what kind of treatments can help with her symptoms?
We can ease the pain with some analgesics. This will deal with the peripheral and central nervous system to eventually reverse sensation. Normally this would be a bad thing, however, given Jay's shorter-term case, this is one of the best options. We can also help to periodically control her thyroid and liver functions with lithium citrate. This is a lower-risk drug that has actually showed a decrease in N-acetyl aspartate in the brain. While this is not necessarily a permanent cure, it is the best current treatment for this disease. It has been proven to lead to a better quality of life for the patient.
Can we start Jay on this sometime soon? Are there other options?
There is also gene therapy. This has been used as a treatment only more recently and has showed some promise. Some patients who have been through this treatment are still alive today and are well into their teenage years.
What is gene therapy?
Gene therapy for this disease is delivered using 6 burr holes. The process tries to reintroduce the missing ASPA gene into the system.
Okay, so what's Jay's best option?
Overall, for right now, I think it would be best to begin with lithium citrate because it is a less invasive procedure and we will be able to confirm if it is working fairly quickly. If it seems unsuccessful, we could begin gene therapy for Jay.
Okay, so there is a chance she can live to be older than 10.
There is a chance. However, this type of treatment is an ongoing process that should be taken one step at a time. First, focus on milestones, and then we can begin to determine Jay's chance at a longer life.
Thank you so much.
I will write you a prescription for the first dose of lithium citrate, and I'll be checking in with you.
All right, we will schedule another appointment for next week.
Perfect, and just call my office if you need anything for Jay or have any emergencies or questions. I will do my best to answer.
Thank you, doctor.
No problem.